Immune Physiology. Ms. Walker here. I'm going to demonstrate how to do tomorrow's lab so you can figure out your blood type. Make sure that you have your parent permission form signed if you want to participate in the lab tomorrow. If you don't get that piece of paper signed or if I don't get an email from a parent, then you won't be able to participate. So if you want to take a closer look at what we have here, you can see that you're going to have a certain couple things at your lab table. First, you're going to have a waste container. This is going to be for your used alcohol wipes as well as used toothpicks that you use to mix the blood. You also are going to have a waste container for your sharp. This is for the lancet that you use to break the skin of your finger. It'll go in the sharps container, which will be disposed of safely. So the first thing that you're going to do is you're going to want to make sure you wash your hands. So you can use a sink with the soap, and then you are going to use an alcohol prep pad to clean off the middle finger of your non-writing hand. So I'm right-handed, so I'm going to be using my left hand as my blood source. Something they suggest doing is shaking your hand so you can try to get some blood flow there specifically. But it's really important that after you sterilize your finger that you don't blow air on it or you don't touch it to anything, because that can transfer bacteria to the opening, which can cause you to get an infection. So we'll try to keep that as clean and sterile as possible. So you take out your alcohol prep pad, you're going to wipe the middle finger of your non-writing hand so that it gets all clean and sterile. You might want to have your lab partner help you by opening up now your MediPoint blood lancet, but I'm going to go ahead and do that, just not using my middle finger. So this lancet has an end that has a tip that's very, very, very sharp. I should be disposing of all of these in the waste container. Really sharp. And so you're going to need to jab your finger pretty hard in order to draw blood from it. So you'll take the sharp end and just a quick jab. If you want to zoom in, you can see that a drop of blood will begin to accumulate. Then you're going to put each drop of blood on the two spaces in your card. One for the anti-A test, and if you keep squeezing, you should get one also for drop for anti-B. Hopefully that's enough blood. We'll see in a minute. Once you're done, you can then wipe your finger dry with your second alcohol prep pad. So just wipe the excess blood off and place that again in the biohazard waste container there. So the next thing that we have to do is we want to mix some of our antibodies with the blood in order to see if it clumps. So the blue vial is our anti-A serum. So you are going to use the blue mixing stick after you place a drop of this onto your blood. Just one drop there to mix in. And then you can swirl it around with this little stick. Your results will take up to a minute to show to see if any clumping occurs. You dispose of this mixing stick back in your biohazard waste because that's going to have had your blood on it, so you don't want that. And then you'll do the same with the anti-B. So you put one drop of the serum on the blood. And again, you're going to not cross-contaminate, now you're going to mix it with the yellow mixing stick. Oops, if that happens, it's okay, we're going to disinfect everything. Okay. And then again, you'll throw that away in your biohazard waste. So all of your waste, everything that you use that has touched blood is going to go into your biohazard cup in the middle that will disinfect and get rid of. And then your sharp is going to go into the blue sharps container. I only have one bottle of each of these, so you'll have to come up to the front to get those drops. We'll sit and wait for a minute, and let's take a look at the results. If you zoom in here now, it hasn't been quite a minute, but you can already see the clumping starting to occur. If you look at anti-A, you'll see that the blood is clotting. I don't know if you can see it. Can you see it very well? Focus on it. Okay, not very well. And then anti-B, it's not clotting. So these results would suggest that I have what kind of blood, A or B, or AB, or O. I guess that's what you'll have to figure out. Okay, I'll see you tomorrow in lab. Bye.